40 Matric learners have been hospitalised in Gauteng after allegedly consuming food from spaza shop. We do have Gauteng Health Department spokesperson Motalatale Modiba to give us some information in relation to this incident. Motalatale, thank you so much for joining us. What can you tell us about this incident?
Well, what we can tell now is that it's actually 74 grade 12 learners. They were from various, they are from various schools within the western areas. They are all female learners. So they were camping, or they are having this Matric camp at one of the schools in the district. So they ate something in the morning, and it looks like whatever that they ate had an effect on them, because all of them started complaining of stomach cramps and being just not feeling so well. So they had diarrhea, some of them. So they were immediately rushed to 2 clinics nearby, and at the clinics they then referred them further to go to the Carletonville hospital for further treatment. 73 were are being treated at the hospital, and then 1 was taken to a private facility. What is good is that they are all doing well. So in fact, just a minute ago, when I was talking to the CEO of the facility, he confirmed that they will start discharging some of them, because they're fairly stable, so they can be discharged to go home.
So, Motalatale, I mean, these incidences are becoming very frequent, right? This is at the back of course, those 5 children that died in Naledi just last week. So, talk to us about what the department is planning on doing to combat the scourge of this practice, and also to fast-track compliance, as well as, of course, investigate what could be the cause of these deaths, as well as, of course, the issues pertaining to some of the products that is sold at these informal shops in townships?
Well, I think we must first locate this whole issue, in that the issue around, from a Gauteng Department of Health point of view, what we're doing and what we've been consistently doing is to continue to raise awareness, to educate the public about the dangers of not handling food, whether it be perishable, non-perishable food items, correctly, to say the protocol that should be applied, and to caution them, obviously, in terms of checking their food labeling, and those type of that can be taken at that level. We have also been raising an alarm around the usage of your pesticides and insecticides, because in some of these incidents, you find that there are traces of organophosphate that shows that people were using your retexes and so forth to try and repel the rodents that they are faced with in their spaces. So we've been really trying to urge the public to apply those correctly, to use alternative methods. But from a point of view of implementation, in terms of the environmental health requirements, we work closely with local municipalities, because in terms of the law, it is something that resides with municipalities. They are able to issue fines. They are able to shut down establishments who are not complying. So it's a competence that is lying with municipalities, but we're not sitting back to say, because it's a competency that is there, we can't play a role. We play a greater role in terms of raising awareness, because we're not empowered by law to go to establishments and close them. The other thing that we're also doing is that to also raise further awareness around the dangers of illegal dumping in our communities, because that then creates an environment where you have a rodent infestation that now people must deal with. And in dealing with it, you then end up having all these rather unfortunate incidents. But in relation to the incident at the school, that one that we spoke about earlier, there is a question of the proper handling of food. We're now into the summer period. Food gets easily rotten if it's not properly stored, and so we then keep on encouraging the public to also check some of those things, including service providers that are rendering services, because in this instance, so many children got affected. It means they ate a common meal that would have been provided from somewhere, and then the question then becomes, how was that food prepared, and how long had that food been prepared prior to this. So we can never stop raising more awareness to the public, just to know certain things that can be done to avoid this type of incidents.
And then where can the public then report any dealers or, of course, service providers or food providers, Motalatale, that they suspect could not be adhering to the health as well as safety standards for South Africa?
They have to report that at their local municipalities. Like I said, that your municipalities are the ones that are empowered by law, and they've got the relevant bylaws to actually be able to enforce. They can actually be able to clamp down on this. So because we've got various municipalities within the province of Gauteng, so they will each have their way of handling this. But essentially, people would need to report this to their local authorities, their local municipalities, which have got environmental health offices that are empowered to can be able to act. Of course, I mean, if they report it to our facilities as well, we do dispatch people out to go and check, but we still need to call on the environmental health practitioners at the local authority level. Those are the people that have the right authority to can be able to close down or to even issue fines. So if depending on which municipality you are at, you would need to be able to report it at your local authority, because those are the people that are empowered to can be able to act further on this.
All right, and a very quick one, Motalatale, do you have any update on the status of those hospitalized pupils at this stage?
What we know is that the majority of them are now starting to be released, because they were fortunately in a very stable condition. So earlier on, when we just checked with the CEO, he was saying they are actually preparing now to start releasing some of those learners. I'm sure that in the next maybe hour or two, we should be able to give a status update in terms of how many have since been released to go back home, because they were not in a condition where they really required hospitalization. It's just that it was quite a number of them who needed immediate attention.
All right, Motalatale, thank you so much for that engagement with us this afternoon. That is Gauteng Health Department spokesperson, Mr. Motalatale Modiba, there on an update on those matriculants or school children, 70 of them, as we understand, according to the health department's statement, they have been hospitalized. And as you heard, some of them have started being discharged.